18 years ago, as the New York City registrar, I experienced the impact of disaster on mortality reporting firsthand during and after the events of 9/11. I saw firsthand how this event demonstrated the ability of vital records offices to be facile in time of disaster, including in the wake of disasters that occur with no warning or time to prepare. However, translating that jurisdiction-specific experience to the national level remains challenging. Timeliness and quality of mortality data reporting have made strides over the last 18 years since the events of 9/11. Both of these factors are critical to improved response to mortality reporting in the wake of disasters. Over the last 10 years or so, in particular, the National Vital Statistics System of the National Center for Health Statistics has made dramatic improvements in timeliness of reporting data. In 2011, only about 11% of all the deaths in the U.S. were reported to NCHS within 10 days of death. By 2019, 8 years later, that number rose to over 60% of deaths reported to NCHS within 10 days of death. Improved timeliness in general will translate into improved timeliness during time of crisis or disaster. These improvements in timeliness have allowed us to disseminate data more quickly. National death data was formerly reported 2 years after the end of the data year. For the last few years, final data were reported within 1 year. We also have quarterly provisional estimates of death rates that are based on death records received and processed by NCHS each quarter. Most recently, we responded to the needs of the drug overdose crisis and were able to release provisional monthly drug overdose deaths counts quarterly. Improvements in coding of deaths, particularly in times of disaster, is needed and ongoing. As of about 2010, NCHS codes and causes death for all states using a largely automated cause of death coding system. In 2019, 77% of the deaths were coded automatically, and just 1/4 were coded manually. We must continue to work towards auto-coding as many records as possible in order to speed time of reporting, particularly during a disaster. NCHS is working on retooling our coding systems to incorporate natural language processing and machine learning to improve the throughput. For NCHS to code cause of death as disaster-related, the information about the death needs to be explicitly stated on the death certificate. To facilitate this, NCHS has worked with NCEH to develop a reference guide to help medical certifiers learn how to accurately complete the cause of death, which enables the number of disaster deaths to be accurately counted. We are also actively working with states to improve the data systems through our cooperative agreements as there are opportunities for their data to improve. There are still 4 states and 5 U.S. territories that do not have electronic death registration systems. Because the U.S. is relying on NCHS to provide national statistics on deaths due to drug overdoses, NCHS has received opioid funding that will be awarded shortly to help the remaining states roll out new EDR systems, expand existing systems, and help states interoperate better, since we know that disasters do not always stay within state boundaries. Medical examiners and coroners should be certifying most disaster-related deaths, so strengthening their capacity is critical. Many recommendations and reports have been written on ways to strengthen their systems. Addressing these deficiencies will help the underpinning of mortality surveillance for disaster-related deaths and other complicated deaths of public health importance, which disproportionately impact young working populations. Improving the quality of the cause of death is one of the major priorities of NCHS and the National Vital Statistics System. To achieve an improvement will require addressing the problem on several fronts. As noted, one of the most important efforts is completion of the cause of death field. To that end, I am pleased to announce the release of a new cause of death mobile application and cause of death e-learning module. The mobile app is a quick reference guide for clinicians when they need to certify a death, including providing instructions and examples of how to fill out a death certificate. It is designed to acquaint physicians, medical students, and others with the vital registration system in the U.S. and to provide instructions for completing death certificates. The online e-learning training module provides an overview of the vital registration system and explains the critical role of physicians in providing the best data possible. As the National Vital Statistics System continues to strengthen and improve, there will be more opportunities to share data across and among states and through better interoperable systems. Investing in the data infrastructure used for NVSS to collect, record, report, and utilize data on a daily basis will greatly assist when in times of crisis. During a disaster, it is important to try to minimize new procedures and practices. Death certification must happen quickly and accurately, and it is a priority for government and family needs. A system that is well-tooled for daily use will be better able to adapt in time of crisis. Data from these systems may be used to guide preparedness and response planning.